Now, there are growing concerns over the impact of the continuing NEHAWU wage strike on the country's health system. The Health Professions Council of South Africa is the latest to speak out against acts of violence and intimidation during that strike. The HPCSA is appealing to striking workers to allow non-striking workers to continue with their work of saving lives. The Health Department says it's probing the deaths of people possibly as a result of the ongoing strike action, but the union has denied the claims. NEHAWU is demanding that 10% wage hike, while government says it can only afford 3%. Now, for more on this, let's speak to the HPCSA President, Professor Simon Nemutandani. Thank you so much for making time for us, Prof. How concerned are you as the HPCSA about the scenes we witnessed last week during this protest?
Well, we are very much concerned because we have seen clips that were showing that patients were denied access to the facilities. Some of the staff members who wanted to render the services were not allowed. We are very much concerned and we say this is unacceptable. People should exercise their rights, but they should also respect the rights of those who want to continue rendering the service. We would not really accept where the striking members are preventing patients from accessing health services. Life is at risk and we cannot take that risk for now.
You have the responsibility as the HPCSA to ensure the protection and safety of healthcare workers registered with the council. How have you done that? Have you been able to do that?
Well, we have for a limited, because we are not directly involved. But our role as protecting the community, we are to make sure that the health facilities are up to standard, that our communities, when they visit those facilities...
Prof, asking you, you told us how concerned you are as the HPCSA, but when we went to that briefing, you were explaining the work that you have done to try and protect health professionals that are members of your council.
Yeah, all we are saying, while we condemn the violence that has been happening in the prevention of patients from accessing the service, we must also send a strong message to government that it is unacceptable to continue with the current process where there are shortages of staff members and some of the people are working under difficult conditions. The equipment are not up to scratch. There is no availability of medicine. That cannot be accepted. Government should make sure that it provides the resources so that the public is protected. It can't be that patients go to the health centers, clinics, and they find that there are no doctors or no nurses or staff members to render service to them. We should, on the same breath, say that government must protect the public by making sure that our facilities are well equipped, our employees are well remunerated, and if government can do that, we will be protecting the public. But we cannot just condemn those that are violent and also not forget what government should be playing in making sure that the services are available.
Yes. What impact have your members seen, Prof, on healthcare services in different hospitals? Some patients have been discharged prematurely. There are people who have missed their treatment, and the health ministry just yesterday was confirming 4 deaths so far that are linked to these protests.
Well, reports are coming. As you are aware, HPCSA is a regulatory body. So if anyone, member of the community, feels that they have been prevented from accessing the services, either by those that are striking or by health practitioners, they should report them to us. If those who have prevented them are our members or neglected the patient, we'll take strong actions against them. But at the same time, we are saying CEOs and hospital managers should put plans in such an event to say, how do we really reduce the impact of making sure that life is not lost? We understand that there may not be proper planning, but there is no need for life to be lost if proper planning has been done.
So the provision of healthcare is an essential service, and the public has the right to access these basic human rights services as guaranteed by the Constitution. What message are you sending out to striking workers?
We are saying all health practitioners have made an oath that patient will become their priority. In a case where there are competing interests, patient life comes first. And that is what we are sending to all our health practitioners to say, please make sure that life is saved. And at the same time, we are saying government and employees should not be impossible or difficult to address the needs of the employees because they have sacrificed a lot. During COVID, we have lost a number of our practitioners because they were committing to really work under difficult conditions when everyone was afraid. So government should come to the party and make sure that they do engage with the employees. I don't think they are unreasonable, but they could meet each other halfway. So our call is to say all parties must find an amicable solution to make sure that no further lives are lost in these conditions.
So the problem, others will argue, is that the two parties are too far apart. You've got the unions who are insisting on this 10% increase. You've got government that says we're not going to take this, up. This is the initial, proposal that we've given to you guys, and we're not going to be moving too far from here. Do you get a sense that government has the appetite to also respond to, the difficulties and challenges that health professionals are facing? Because it appears, so often that government is reactive. So instead of just sitting down and saying, we see the work you've done, we appreciate what you've done even during COVID-19, and this is how we demonstrate that appreciation. It's almost like they wait for the workers to go on strike before they can start reconsidering, right, what they're asking and say thank you for the contribution they make.
You see, it's a very difficult question that you are posing to me, but I will safely say, in an area where there are two parties that have different views, and one of it is about whether we should give in, and the others whether they are saying, can we really sacrifice? There must be a compromise between the two. But at the center of it is patient life. This is where it's very difficult to comprehend why should we come to this stage where people have to down the tools or even strike, because once lives are lost, after the strike, we can't go back to the mortuary or to the graves and say, we are sorry. Life has been lost, now we have achieved or we have given in to what government has been demanding or what the employer has been demanding. But safe to say, the two parties must find each other very soon. We cannot delay anymore. It has to happen soon. And I think all those that are involved in the negotiation should put pressure on both sides to make sure that solutions are found.
All right, Professor Simon Nemutandani, President of the HPCSA, thank you so much for making time for us.